It started with something small. Margaret, a 72-year-old grandmother, began forgetting where she left her keys. Then it was names, then appointments. Her family assumed it was just normal aging. But what they didn't know was that Margaret's daily medication, the pills she trusted to keep her healthy, were quietly clouding her mind. Within months, her once sharp memory dulled, and confusion took its place. Stories like Margaret's are more common than many realize. Across the world, seniors are taking prescriptions for sleep, allergies, bladder control, or even heartburn, never suspecting that those very drugs might be stealing away their clarity and independence. Here's the shocking truth. Research shows that some of the most popular medications for seniors are directly linked to memory loss and even dementia-like symptoms. The effects are subtle at first, but over time they can rob a person of their sharpness, their personality, even their freedom. That's why in today's video, we're uncovering 9 medications every senior needs to know about. I'll explain how these drugs affect the brain, why older adults are especially vulnerable, and the safer alternatives you can ask your doctor about. But before we dive in, remember this: never stop or change your medication without medical guidance. The goal of this video is not fear, it's empowerment. With knowledge, you can protect your memory, keep your independence, and live your golden years with the clarity you deserve. Why this matters. Margaret's story isn't an isolated case, it's a warning. Right now, millions of older adults are taking medications that were designed to ease one problem, only to create another: harm to the brain. And the heartbreaking part is, many families don't realize it until the changes become too obvious to ignore. Memory loss in seniors is often blamed on aging or genetics, but the truth is more complicated. The human brain relies on a delicate balance of chemicals to store and retrieve memories. One of the most important is acetylcholine, a neurotransmitter that acts like the brain's messenger system, carrying signals that control memory, focus, and even muscle function. Here's where the danger begins. Many common medications, prescribed for things like allergies, sleep, bladder control, or anxiety, interfere with this messenger system. They block acetylcholine, leaving the brain struggling to communicate with itself. At first, the effects are subtle: a little forgetfulness, some brain fog, maybe a lapse in focus. But over time, the damage compounds. Studies show that seniors who take these drugs for years face a dramatically higher risk of dementia. And it's not just about memory. These medications can also cause dizziness, slower reaction times, and confusion, putting seniors at greater risk of falls, accidents, and a loss of independence. This matters because memory is more than just facts and dates. It's our life story. It's knowing our children's faces, remembering the laughter of a grandchild, holding on to the lessons of a lifetime. When medications take that away, they take away who we are. That's why shining a light on this issue is so important. Most seniors never get warned about these risks. Doctors may prescribe these medications out of habit, or because they don't realize there are safer alternatives. But once you know the truth, you can have that vital conversation with your healthcare provider. In this video, we'll walk through 9 of the most common medications that research has linked to memory problems in seniors. For each, I'll explain why it affects the brain, give examples you might recognize, and share safer options to discuss with your doctor. Because when it comes to protecting your mind, knowledge isn't just power, it's preservation. Let's begin with one of the most common culprits: antihistamines. If you've ever taken something for allergies, a runny nose, or even a quick fix for sleep, chances are you've used an antihistamine. For decades, medications like Benadryl, chlortrimeton, or Tylenol PM have been staples in medicine cabinets. Seniors often turn to them because they're cheap, easy to find, and seem harmless. After all, they're sold over the counter without a prescription. But here's the hidden danger. These older antihistamines have strong anticholinergic properties. That means they block acetylcholine, the chemical your brain relies on for memory and alertness. It's like shutting down the switchboard that helps your brain connect the dots. At first, you might just feel drowsy, groggy, or a little foggy after taking them. But when these drugs are used regularly, especially in older adults, the long-term effects are much more serious. Research shows that seniors who take anticholinergic medications like diphenhydramine, the ingredient in Benadryl, and many sleep aids for 3 years or more face a significantly higher risk of dementia. In fact, one major study found the risk jumped by more than 50%. Think about that for a moment. A pill that helps you sleep tonight could be silently robbing you of your memory in the years to come. And here's another layer of danger. Because these medications cause drowsiness and slow reflexes, they also increase the risk of falls and injuries. For seniors, a single fall can change everything, leading to broken bones, hospital stays, and a loss of independence. So what are the alternatives? Thankfully, there are newer antihistamines like loratadine, Claritin, cetirizine, Zyrtec, or fexofenadine, Allegra. These are much less likely to affect memory or brain function, and if you're using antihistamines as a sleep aid, it may be time to talk to your doctor about safer sleep solutions like melatonin or natural lifestyle adjustments. The key takeaway is this: antihistamines might seem harmless, but for seniors, the risks far outweigh the benefits. If you or a loved one is taking them regularly, bring it up with your doctor. Your memory is too precious to trade for a quick fix. Another group of medications that often surprise people are those used for overactive bladder or urinary incontinence. These drugs promise freedom, no more rushing to the bathroom, no more embarrassing leaks. But what they don't advertise is the heavy toll they can take on the brain. Some of the most commonly prescribed bladder medications include oxybutynin, ditropan, tolterodine, Detrol, and solifenacin, Vesicare. These drugs belong to a class called antimuscarinics, and like the antihistamines we just discussed, they work by blocking acetylcholine. Now, acetylcholine isn't just important for memory. It also plays a role in how nerves communicate with muscles, including the bladder. That's why these drugs can reduce bladder spasms and calm frequent urges. But here's the catch. The same chemical messenger that helps control the bladder is also vital for learning, attention, and memory. By blocking it, these medications don't just calm the bladder, they cloud the brain. Research has shown that older adults who take bladder medications regularly are at a significantly higher risk of confusion, disorientation, and dementia. In fact, some studies suggest that oxybutynin in particular may be one of the strongest offenders when it comes to harming memory. The tragedy is that many seniors take these drugs for years, unaware of the risks simply because no one told them. Families sometimes notice a loved one becoming more forgetful or less sharp, and they assume it's just old age, never realizing the bladder medication is partly to blame. So, what are the safer options? One alternative is Mirbitriq, a newer type of bladder medication that works differently and doesn't block acetylcholine. Some people also find relief through pelvic floor therapy, bladder training exercises, lifestyle adjustments, or even limiting bladder irritants like caffeine. These approaches may take patience, but they protect your brain while still helping you regain control. Remember, dignity and independence are about more than avoiding bathroom trips. They're also about preserving memory, clarity, and selfhood. Don't let a bladder medication quietly take those away. Depression is a very real struggle for many older adults, and the right treatment can make the difference between hopelessness and joy. But not all antidepressants are created equal, especially when it comes to protecting the brain. One class in particular, called tricyclic antidepressants, TCAs, is known for its troubling side effects in seniors. Some of the most common names you may recognize include amitriptyline, Elavil, nortriptyline, Pamelor, and imipramine, tofranil. These drugs were once the gold standard for depression and anxiety, but today they're considered outdated for many patients, largely because of how they affect the brain. Like the medications we've already discussed, tricyclic antidepressants have anticholinergic properties. They interfere with acetylcholine, the chemical messenger vital for memory and learning. That means while they may ease depression symptoms, they can also cause brain fog, drowsiness, confusion, and long-term memory problems. The danger doesn't stop there. TCAs can also cause low blood pressure, dizziness, and irregular heart rhythms, which makes them especially risky for older adults. Combine memory issues with dizziness, and the risk of falls skyrockets, a double blow to a senior's health and independence. So why are they still prescribed? Often it's out of habit, or because TCAs can help with secondary problems like chronic pain, migraines, or sleep disturbances. Doctors sometimes reach for them because they've been around for decades and are inexpensive, but the hidden cost is paid by the patient's memory and quality of life. Thankfully, there are safer and more modern options. SSRIs, selective serotonin reuptake inhibitors, such as sertraline, Zoloft, escitalopram, Lexapro, or citalopram, Celexa, are usually much better tolerated by seniors and don't have the same devastating effect on memory. For those needing help with pain or sleep, non-drug approaches like gentle exercise, relaxation therapy, or cognitive behavioral therapy may also offer relief without risking the brain. The key message is this: while depression must be taken seriously, so must the side effects of treatment. A medication that lifts your mood but slowly erases your memories is not a fair trade. Seniors deserve both mental health and mental clarity. Life can be stressful at any age, but for many seniors, anxiety, worry, and sleepless nights become constant companions. To ease that, doctors often prescribe a class of medications called benzodiazepines, sometimes nicknamed benzos. You may recognize some of the common names: diazepam, Valium, alprazolam, Xanax, lorazepam, Ativan, and clonazepam, Klonopin. These drugs are designed to calm the nervous system. They work by enhancing the effects of a chemical in the brain called GABA, which quiets nerve activity, helping with anxiety, panic attacks, muscle spasms, or insomnia. At first, they can seem like miracle pills, taking away stress, calming nerves, and allowing sleep to finally come. But here's the hidden truth. For seniors, benzodiazepines can do far more harm than good. These medications slow brain function. Over time, they can lead to memory loss, daytime drowsiness, slower reaction times, and confusion. Seniors who take benzodiazepines are also at a much higher risk of falls, car accidents, and injuries. Worse still, long-term use has been linked to an increased risk of developing dementia. And here's the catch: benzos are highly habit-forming. Many seniors start with a small dose just for sleep or just for stress, but over time the body adapts. The same pill stops working as well, leading to higher doses or daily dependence. Before long, the brain struggles to function without it, and stopping suddenly can cause dangerous withdrawal symptoms. So what can be done instead? For anxiety, doctors often recommend safer options like SSRIs or non-drug therapies, such as cognitive behavioral therapy, CBT, meditation, or gentle exercise. For sleep, natural aids like melatonin, better sleep hygiene, or relaxation techniques can make a real difference without clouding the brain. The takeaway is this: benzodiazepines may bring short-term calm, but in the long run they can steal memory, independence, and clarity. For seniors, those losses are far too high a price to pay for a few hours of sleep or temporary relief from anxiety. For many seniors, sleepless nights feel endless. Tossing, turning, watching the clock tick past midnight. It's exhausting. That's why medications like Zolpidem, Ambien, Azopiclone, Lunesta, and Zaleplon, Sonata, often called the Z drugs, became so popular. They're marketed as safer alternatives to benzodiazepines with the promise of deep, restful sleep. But here's what's rarely said out loud. While they may help you fall asleep faster, they carry their own serious dangers, especially for older adults. These medications act in a similar way to benzodiazepines, slowing brain activity. And just like benzos, they can cause daytime drowsiness, confusion, memory lapses, and poor concentration. Seniors who take Z drugs regularly are also at a much higher risk for falls, fractures, and car accidents. Imagine waking up groggy, trying to walk to the bathroom at night, and losing your balance. That's how quickly a sleep aid can turn into a hospital visit. The long-term picture is even more concerning. Several studies have linked prolonged use of these drugs with cognitive decline and dementia-like symptoms. In fact, many geriatric specialists now warn against their routine use in seniors because the risks often outweigh the benefits. And here's a hidden side effect most people never hear about: sleepwalking and memory blackouts. Some seniors report cooking, eating, or even trying to drive in their sleep, waking up the next morning with no memory of what happened. That's how powerful these drugs can be in disrupting the brain. So, what's the alternative? The good news is that there are safer, non-drug strategies that often work just as well in the long run. These include melatonin supplements, which support the body's natural sleep cycle; sleep hygiene practices, keeping a regular bedtime, reducing caffeine, limiting screen time before bed; relaxation techniques like deep breathing, gentle stretching, or calming music. For those with chronic insomnia, cognitive behavioral therapy for insomnia, CBTI, is proven to be one of the most effective treatments, without the side effects. The bottom line is this: while the promise of sleep in a pill is tempting, the hidden costs, falls, memory problems, and confusion, are far too steep. Seniors deserve rest, yes, but they also deserve to wake up clear, steady, and safe. Sometimes seniors develop symptoms like extreme agitation, hallucinations, or aggressive behavior. To manage these, doctors may prescribe antipsychotic medications. The most common names include risperidone, Risperdal, haloperidol, Haldol, quetiapine, Seroquel, and olanzapine, Zyprexa. These drugs were originally designed for serious mental illnesses like schizophrenia or bipolar disorder. But over the years, they've often been used in elderly patients, particularly those with Alzheimer's disease or other dementias, to calm aggression, paranoia, or severe mood swings. Here's the danger: while antipsychotics may calm difficult behavior, they can also cause devastating side effects in seniors. Research shows that in older adults with dementia, antipsychotics can increase the risk of stroke, severe confusion, rapid cognitive decline, and even death. So serious, in fact, that the FDA has placed a black box warning on these medications when used in elderly patients with dementia. Even short-term use can cause troubling issues like drowsiness, tremors, stiffness, and difficulty walking. These effects not only cloud the mind but also raise the risk of falls and injuries, something that can drastically reduce a senior's independence. So why are they still prescribed? Often, it's because families and caregivers feel desperate. When a loved one is restless, angry, or hallucinating, it can feel impossible to manage without medication. Doctors sometimes use antipsychotics as a last resort when safer options haven't worked. But here's the empowering truth: there are other approaches, non-drug strategies, like creating calm environments, using gentle redirection, reducing overstimulation, and engaging seniors in activities they enjoy, can often reduce agitation without medication. When medications truly are necessary, the lowest dose for the shortest possible time is always best. The key message here is this: antipsychotics should never be a first-line choice for seniors with dementia. They may calm the storm in the short run, but in the long run, they can accelerate decline and take away precious time. Every senior deserves dignity, clarity, and compassion, not just sedation.
Chronic pain is one of the toughest battles seniors face. Arthritis, back problems, past injuries, they all take a toll, and many older adults are desperate for relief. That's why doctors often prescribe opioid painkillers. Some of the most common names include oxycodone, OxyContin, Percocet, hydrocodone, Vicodin, Norco, morphine, codeine, and fentanyl. These medications are extremely powerful, and when used for short-term, severe pain, such as after surgery, they can be effective. But for seniors dealing with long-term pain, opioids can become a dangerous trap. Here's why. Opioids don't just dull pain. They also slow down the brain. Seniors who take them regularly often report confusion, drowsiness, slower thinking, and memory problems. In some cases, opioids can even cause hallucinations or delirium. Over time, this mental fog can rob seniors of their sharpness, independence, and quality of life. The physical dangers are just as serious. Opioids can cause dizziness and unsteadiness, raising the risk of falls, a major threat to seniors' safety. They also slow down breathing, which can be life-threatening in high doses. And of course, there's the issue of dependence and addiction. Even when taken as prescribed, opioids can cause the body to become reliant on them, making it extremely hard to stop. Yet here's the part most people don't realize. For many types of chronic pain, opioids don't work better than safer alternatives. In fact, long-term opioid use often leads to something called opioid-induced hyperalgesia, where the brain becomes more sensitive to pain, not less. That means the very medication meant to relieve suffering can actually make pain worse over time. So what are the options? For many seniors, safer pain relief can be found in acetaminophen, Tylenol, topical creams and patches, gentle physical therapy, exercise, and even mindfulness or relaxation practices. In some cases, non-opioid prescription medications may also help manage pain without clouding the brain. The message here is clear. While opioids have their place in medicine, long-term use in seniors is a dangerous gamble with both memory and independence. Pain management should never come at the cost of losing yourself in the process.
Heartburn, indigestion, and acid reflux are struggles that many seniors know all too well. To bring relief, doctors often prescribe a class of drugs called proton pump inhibitors, or PPIs. You may know them by names like omeprazole, Prilosec, esomeprazole, Nexium, lansoprazole, Prevacid, or pantoprazole, Protonix. At first glance, PPIs seem like wonder drugs. They work by shutting down acid production in the stomach, preventing the burning and discomfort of reflux. Millions of seniors take them daily, often for years on end. But here's the hidden truth. These medications were originally meant for short-term use, just a few weeks, not a lifetime. Why does this matter for brain health? Research has linked long-term PPI use with vitamin B12 deficiency. Vitamin B12 is essential for healthy nerve and brain function, and without enough of it, seniors can develop symptoms like confusion, memory loss, mood changes, and even dementia-like decline. That's not all. Prolonged PPI use has also been associated with a higher risk of stroke, kidney problems, bone fractures, and infections. For seniors, that's a dangerous combination: weak bones, foggy memory, and added health complications. And yet many seniors are kept on PPIs for years without ever being reassessed. Doctors may continue refilling the prescription out of habit, or patients keep buying them over the counter without realizing the long-term consequences. So what can be done instead? For many seniors, safer alternatives include lifestyle changes, eating smaller meals, avoiding late-night snacks, cutting down on caffeine, alcohol, and spicy foods, elevating the head of the bed to reduce nighttime reflux, switching to H2 blockers like famotidine, Pepcid, which may be safer for long-term use in some cases, and importantly, getting checked for vitamin B12 levels if you've been on PPIs for more than a year. The lesson here is simple. PPIs can be life-changing when used properly, but long-term, unsupervised use can quietly chip away at memory, strength, and independence. Relief from heartburn should never come at the cost of brain health. So far, we've talked about antihistamines, bladder medications, antidepressants, sleep aids, and more. But there's one final group that ties this all together: other anticholinergic drugs. These medications come in many forms and are often prescribed for conditions like Parkinson's disease, motion sickness, and certain types of stomach or muscle problems. Some of the names you may recognize include benztropine, Cogentin, trihexyphenidyl, Artane, and scopolamine patches, the ones often used to prevent seasickness. On the surface, they seem harmless, even helpful, but all of these drugs share one dangerous trait. They strongly block acetylcholine, the very brain chemical we've been talking about. And when that happens, memory and thinking ability take a direct hit. For seniors, the side effects can be devastating. These medications are well known to cause confusion, delirium, blurred vision, constipation, urinary retention, and rapid memory loss. Families sometimes describe it as if their loved one suddenly aged 10 years overnight after starting one of these drugs. Even worse, Because they're used for conditions like Parkinson's, doctors may see the confusion and memory problems as part of the disease rather than a side effect of the medication. That means the drug gets continued and the cognitive decline worsens. So what are the alternatives? In some cases, newer medications or non-drug strategies can help manage symptoms with fewer risks. For example, with Parkinson's disease, doctors may adjust other therapies or use physical therapy and exercise to improve mobility. For nausea or motion sickness, non-drug remedies like ginger, acupressure bands, or safer medications may be considered. The key takeaway is this: if you or someone you love is prescribed an anticholinergic drug, especially one for Parkinson's or motion sickness, it's worth having a serious conversation with the doctor. These medications may be doing more harm than good, and safer solutions may be available. Because when it comes to your brain, every choice matters. Protecting memory and clarity should always be the top priority. After hearing this list of medications, you might be wondering, why do so many different drugs cause memory loss? How can a pill for sleep, allergies, or even bladder control all affect the brain in the same way? The answer lies in one word: acetylcholine. Acetylcholine is one of the most important chemical messengers in the brain. It's responsible for carrying signals that control memory, learning, attention, and even muscle movement. You can think of it like the brain's telephone system, passing messages from one nerve cell to another. Now here's the problem. Many of the drugs we've talked about are anticholinergic. That means they block acetylcholine. It's like cutting the phone lines in your brain. Suddenly, the messages can't get through. At first, this causes short-term effects like grogginess, confusion, blurred vision, or forgetfulness. But when seniors take these medications day after day, year after year, the damage builds. Research has shown that the longer and higher the exposure, the greater the risk of developing dementia or long-term memory decline. One landmark study published in JAMA Internal Medicine followed thousands of seniors for more than a decade. The researchers found that those who had high cumulative exposure to anticholinergic drugs faced a 54% greater risk of dementia compared to those who didn't. That's not a small increase. It's life-changing, and acetylcholine isn't the only factor. Drugs like benzodiazepines and sleep medications affect another brain system called GABA. While GABA calms the nervous system, too much sedation leads to slowed thinking, drowsiness, and impaired memory. Over time, that mental slowing can mimic dementia and rob seniors of their sharpness. There's also the issue of drug sensitivity. Seniors process medications differently than younger adults. The body breaks down drugs more slowly with age, meaning they linger longer in the system. Combine that with multiple prescriptions, something known as polypharmacy, and the risk of dangerous side effects multiplies. This science is why organizations like the American Geriatric Society include many of these drugs on their Beers criteria list, a guideline of medications considered potentially inappropriate for older adults. In other words, experts already know these drugs are risky, yet many seniors still take them without being warned. The takeaway is simple. These drugs don't just manage symptoms, they tamper with brain chemistry. And for seniors, that's a gamble with memory, independence, and identity itself. We've covered a lot today. 9 groups of medications that may help with one problem, but quietly harm the brain. From antihistamines and bladder drugs to antidepressants, sleep aids, and even common heartburn pills, the truth is clear. What's in your medicine cabinet could be affecting more than just your body. It could be changing your mind. But here's the hope. Knowledge is power. Now that you know the risks, you're in a position to take control. The next time you see your doctor or pharmacist, bring up what you learned today. Ask about safer alternatives. Request a medication review. Small changes, like switching to newer drugs, adjusting doses, or trying lifestyle solutions, can make a huge difference in protecting your memory. And remember this, you are not powerless. You are not destined to lose yourself to brain fog or confusion. With the right support, you can safeguard your most precious gift, your mind. Because growing older should never mean giving up your independence, your stories, or your clarity. So if this video spoke to you, don't keep it to yourself. Share it with a friend, a spouse, or someone you love. Together, we can help more seniors protect their memories and live their golden years with confidence and strength. Thank you for watching. If you found this valuable, please give it a thumbs up, subscribe for more life-saving insights, and hit the notification bell so you never miss a new video. And as always, this video is for educational purposes only. It's not medical advice. Never stop or change your medication without talking to your doctor first. Take care of yourself, protect your memory, and I'll see you in the next video.